Good evening, ladies and gentlemen, boys and girls. Welcome to JAHAN-E. JAHAN-E has brought for you a very special episode with Dr. Khurshid from London. Let me welcome Dr. Khurshid to my channel. Assalamu alaikum, Dr. Khurshid. How are you?
Walaikum assalam wa rahmatullah. I'm fine, thank you. And thank you very much for the opportunity to be able to connect with your audience. And I'm happy to be part of your whole program. So I do appreciate you're including me into this whole system.
Thank you very much. Dr. Khurshid, you are from London, but I know that you're based and your roots are in India. So my audience will be very happy to know more about you, your education, your achievement, and your background.
That is very true. I brought up in India, so I am an Indian. And my background is that I did my matriculations from Calcutta and my degree and master's from Aligarh Muslim University, and then a further post MSc and a PhD. So my doctorate is, I'm a PhD doctor, not a medical doctor, PhD from the UK. And I am based in London. I've lived in London for quite a few years now. So in terms of my education and working life in the UK, that I work with health services in the UK, and it's that transition which has happened in my life, in my career, and the opportunities I have had and the opportunities to educate myself to be able to work with a system which is a lot more advanced and able to do things and achieve within the system. It's something I think I'm very lucky, very privileged to have that.
Thank you very much, Dr. Khurshid. And I know that your journey from India to UK was not full of roses. Instead, I have to say that you must have worked very hard for that to achieve this height in your life. And I'm always very keen to know that how a person has started from scratch and reached to that place. If you don't mind, will you please throw some light on that?
It's very true. Certainly, it's not easy for anyone. Similarly, it wasn't easy for me either. So it started, and the desire to further my education started in Aligarh. And luckily for me, at the university, there was that kind of atmosphere where there were people, those who were high achievers. They were trying to do things differently. They were striving to go abroad or broaden their horizons. And there were people, those who were willing to help and guide you. So I was very lucky to tap into those resources. And it was a long time ago, so there was no internet at that time, or there was no these social media time, or these ease of access of information. So things were a lot more in letter form, application form at that time. So I used those opportunities. I used to get letters typed. I used to send that by post to the UK. So it was, for any generation, there are challenges. It's hard. So I had my own challenges, but then I had the people and the opportunity, and lucky for me that I got right connections and contacts, those who were willing to help me. And it was through their personal efforts and recommendations that I was not only able to get an admission, but also funding for it. That's the most important. Even at that time, it was quite a lot of money to get this scholarship funding to come to UK to educate yourself. It was, as you would expect, it was challenging, but without trying, without efforts, you just don't achieve it. You have to try, and inshallah, it comes your way.
So nice and so inspiring, mashallah. You were speaking about challenges. Every generation has their own challenge, and 2020 was full of challenges. We all know it very well. And along with these challenges, we had lots of, I must say, lots of hopes as well during 2020. Lots of good things happened during 2020, especially 2020 has brought the people closer. Although we were in the lockdown, we were shut in our houses, but we are very close to each other through this media, social media. Like, I never knew about you, but now during COVID-19, I started this channel and then I came to know about you. You are doing such a fantastic work in London. So you tell me that how this COVID-19 situation during 2020 was for you. Was it full of challenges, and how you look at these challenges?
Very interesting, and you're absolutely right that we were apart, still we have become closer. And also this is one of the things you have already which you have already alluded to, is the opportunities it has brought. So during these challenges, difficult times, there are opportunities those have arisen, and that's the kind of positive thing which has come out of that. What 2020 has shown us, that even the best laid plans, they just don't always materialize. And some of that is not in your control. You just cannot control it. And with this challenge, it's across the world. It's not in one part of the world, of the country, or the system. So what this has done, it's very clearly demonstrated that plans can be made, but it's not necessarily that it can be completed or achieved. So one should be prepared. Okay, so if it hasn't worked out, there are different things. We need to find another route, work differently, try different approach. Also, as you said, it has certainly expedited the expansion of technology. The IT. I've been working from home for nearly over a year now, because it wasn't deemed to be safe to go to office. And I must say, we have achieved a lot within this time. There are a lot of things which used to take longer to implement or to bring about, which we have been able to do a lot quicker, because there are a lot of other barriers have fallen away because of these technological advancement and because of the challenges we faced. Also, this is, for example, one of the things is that out of the 2020, you see vaccine has come out, and vaccines usually take years to come out, to go through testing process and all that. But what has happened, the scientists, they have come together. They have collaborated. They have shared information which they will not normally share. And one of the things scientists have been saying, that vaccines take a long time because funding. So they will do one phase, write an application, get a funding. So what that is, the example I'm using of vaccines coming out so quickly, because this is what the opportunities have arisen because of a calamity, because of the challenges, because of the difficulty. It has brought people together. And some of these scientists, what they did, they were so aware that even last year, January, they started the process. They started creating something even before the DNA was published. So what that shows, that out of each issue, challenge, difficulty, also there is an opportunity. But also one of the important things, and I think it's very important, this has also shown the resilience of human beings. People are resilient. How people in India migrated on foot from one part to another just to be safe, just so that they can be with their loved ones. How people did things which wouldn't have been possible, people could not even imagine before this happened. And two of the examples I would like to illustrate this with, the example of a young girl. using a bicycle to pedal all the way from Bombay or somewhere to a village with her injured father. A mother using a moped and to go and fetch her son or daughter who was stranded in some other place. What this has shown that the human resilience, and especially it has brought out the capabilities of women of our society, young people, those who are not always given that credit. They are not always considered that they are capable of doing all that. So out of this calamity, some of these good things which has come out, and some of that is here to stay. We have to embrace them and use the opportunity to take this forward, enhance it, and keep the good things going and learn from it, not forget. Unfortunately, the human nature is that once things go back to whatever the normal is, one tends to forget about some of these things. So I think it has been tremendous as far as that is concerned.
Yes, thank you very much. Actually, yes, I fully agree that along with the challenges, there were lots of opportunities, especially if we talk about the IT enhancement and in the field of, especially in the field of education and health, as you have given the example of vaccine. I agree that yes, lots of good things happened during this period. Now we will be talking about 2021 because 2021 has brought lots of aspirations, hope, and especially when it comes to vaccine. But I request Dr. Khurshid Sahab to be with us so that you can speak about 2021 in our part 2. And thank you very much for sharing your experiences of COVID-19. And my dear friends, we will be back in part 2. And Dr. Khurshid from London is with me, who is speaking about the challenges and the opportunities of 2021. So stay tuned. Thank you very much for being with us. Take care. Bye-bye.